Today's Rheumatology Day, so we're headed to a rheumatology appointment, supportive husband, passenger seat. Say hi, David.
Hi.
So come along with us as we go to rheumatology, and I'll take you along for my day. Sometimes when you live in a metropolitan city, a good rheumatologist and a good medical facility is worth the travel time. So this was a second opinion appointment about 12 years ago, and I have been going to this facility ever since. It does take us about 45 minutes from home to parking to get there, but it's well worth it. Made it for our day at Keck. Actually, afternoon. It's not a full day today.
Not today.
No. Some days we try to schedule a lot in. And today we probably just have rheumatology and blood work. Hi, my name's Elaine, and I live with autoimmune disease. And we've made it to the rheumatologist, so I'm going to take you along. It's always good to bring a supportive person with you to your rheumatology visit. So mine's my husband. He comes and he listens. He's my ears. Headed into rheumatology. We're in our appointment. We're in the second waiting room. And so this is rheumatology. And I'll let you guys know how my appointment goes.
Here we are.
I just wanted to interject here and give you an update on my appointment. Since you all couldn't come into the actual appointment with me. For a rheumatology patient, our appointment covers a number of things. So the rheumatologist will ask us how we're feeling, and that includes any new pains or any systemic problems we're having, fatigue, problems sleeping at night, problems with digestion. It really depends on your autoimmune disease and what you have going on, what the rheumatologist will cover. The rheumatologist will then look at the patient's joints, look for any swelling, anything to the visible eye that the joint itself has new destruction in it. They'll look for rashes on your skin, and then they order a whole lot of lab work. For any autoimmune disease patient, we look or appear healthy on the outside. Looking at me, you probably don't know there's anything wrong with me if you met me on the street, except for have a really cool swagger, which is called a limp to other people. But we get a whole lot of blood work because oftentimes, and not always, our blood tells more of a story of what's going on. Things like inflammation can be present. A good rheumatologist will always tell you that they don't treat the blood, they treat the person. Now, I know there's a lot of patients out there that haven't encountered those rheumatologists, but I appreciate that. My rheumatologist always tells me that we're not treating the blood, he's treating me as a person. So we go over things and he listens and gives advice, and we go from there and we figure out new treatment plans. So this appointment, we covered that I have an angry gallbladder. It's been acting up. My gastroenterologist actually has been investigating some new GI pain. It's not a new issue for me. I've had gallbladder problems in the past. So our best plan of action is probably to manage that with diet, since surgery isn't always an option for all patients. We also covered that I need my yearly scleroderma testing. For scleroderma patients, we will receive an echocardiogram and a lung test every year. That's to check the progression of our disease, make sure things are being controlled, that there's nothing new sneaking in. So that pretty much was my rheumatology visit. I'll take you along with me as we go get some blood work. The blood work I'm getting is just your standard blood tests for inflammation and for lupus markers. Also thrown into my blood work is iron blood work. Since I am anemic, I need to get my iron checked. Next week I have an appointment with the hematologist, so I guess we'll find out more, but that is what my appointment entailed. And if you have any more questions about what goes on at the rheumatologist, or maybe you're a patient that's gonna go to the rheumatologist for the first time and you feel a bit apprehensive about what's gonna happen, go ahead and leave me a comment down below, and I will be happy to answer any of your questions that you have. Rheumatology's over, we're headed for blood work. Blood work is done. Now it's time to go home.
Please insert your ticket. Please wait. Please drive safely.
So after medical appointments, I like to reward myself. Well, he likes to reward me, and we always go to Starbucks. It's our thing. So here we are at Starbucks to get our Starbucks for a good patient reward.
Good patient reward.